Welcome to the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.
Dr. Josh Luke here with the Health Wealth Podcast and Radio Show. Thanks for joining us again. We have another great guest for you today. It's my honor to have Brian Klepper, who's the principal of Worksite Health Advisors. And I found Brian, this will shock you all as part of the Health Wealth Nation. I found him on LinkedIn, where I spend so many hours a day making sure I share with everybody anything I see that can help reduce healthcare spending in America for businesses and families. So Brian's somebody who has been doing this for a lot longer than I have, and so I thought, hey, what a great opportunity for me to learn from him about what he's been doing and what he sees changing. And so what I want to do is kind of start with how he got into this battle, this war, if you will, against healthcare hyperinflation in the United States, because he's been at it for a long time. And then we'll work our way up to the January 2018 announcements from Apple, Amazon, JP Morgan, Berkshire Hathaway, and now Disney about really blowing up the system and saying we have to start over. We've reached our tipping point. And for those of you who've read Health Wealth, 9 Steps to Financial Recovery, my latest book from Forbes Books, that discussion about the tipping point. And there was an article in the Financial Times even first week of February talking about the tipping point. That literally is the first paragraph of the book. We have reached our tipping point, both as businesses and as families. But what intrigued me about Brian is his work history. Is he's been at this battle forever. And I'm sure he's going to tell us that a lot of people reached their tipping point long ago and unfortunately didn't declare it, so they went out of business or their family went bankrupt. So Brian, welcome to the show. Tell us a little bit about, so you got a PhD in physiology. Was that before or after you started this journey into healthcare affordability?
Oh, that was before. Then I had to decide that I was going to make a living.
So yeah, I have a PhD and I experienced the same thing. So tell us a little bit about where your healthcare journey started and why you became passionate about the affordability issue.
I started off working in a think tank that was devoted to health issues of technology dependent, chronically ill children,
okay.
Very, very sick children, and worked in the policy arena. And then I came out of there and I worked for a children's clinic as their managed care negotiator, and I learned something about the insurance system in that process.
So where did you go from there? I'm sorry, keep going.
Yeah, then I started working I worked for a while for a third-party administration firm that was pretty innovative and did case management and things like that. One thing after another, and then I went out on my own, and I started working for big organizations, a lot of them writing think pieces on what was next in healthcare and what were the issues that we were going to face. And over time, I got more and more interested in this terrible, terrible problem that we have, that healthcare in America just costs so much and is crazy. I mean, it's literally insane.
So would you have called yourself a broker at that time, or were you said
No,
you were a writer? Who were you writing for?
Well, I was writing for general population, for general healthcare populations. But I've always been an advisor to healthcare organizations and also to employers.
Okay.
So I have a lot of large clients as clients who I bring them healthcare organizations. I'll describe this, that get wildly better health outcomes at much, much lower cost than conventional care.
Sure. So it's always funny that the guests I have, they know that this is a leading question, because the word broker on this show is not always a question that ends with a favorable discussion, because most of the folks that are fighting this war were brokers and still are, but just don't like to refer to themselves as brokers because they've gotten out of that box of, hey, I make more money when you spend more money, and said, look, my job is to bring you value, and so I'm going to get out of that broker box and be more of a progressive thinker. So would you fit into that category?
I've never worked as a broker. I've worked as a benefits consultant, but I only get paid by the purchaser if they save money.
Okay.
So that's the way I set up my arrangements, and I'm very scrupulous about that. I think that the broker industry has a lot of problems, and there are a lot of people in it who acknowledge that it has a lot of problems. I think that an effort like Dave Chase has put together through the
Healthcare Rosetta, sure.
the Rosetta Institute to have a new credential for brokers who are willing to have full disclosure of their revenue sources and so on. That's very healthy. That's very positive.
Well, interesting. So, Health Wealth step 4 of the 9 steps to financial recovery, we titled Conduct an Independent Carrier and Broker Expense Review. And really that chapter is pretty brief. It just gets right to the point that you made, which is, hey, is there anybody out there who is not incentivized in some way, shape, or form that can just come in and do an audit of every penny that leaves your organization on healthcare and identify where there is what I like to call wasteful healthcare spending, that really they're not getting any benefit of it? Because really the first step is identifying the waste, and the second step is figuring out how you could do it better. So the answer in step 4 of Health Wealth is there's a couple places you can look, but not a lot, to find that independent person like yourself, Brian, and that is Dave's Rosetta Institute or a benefits consultant. So my question for you as a benefit consultant, and you said very clearly, I only profit when my client saves. What percentage of benefit consultants is that the case for, if you were to guess?
Oh, 0.1.
Not many, right? That's why, yeah, I noted that. So tell us about how you structure these deals for a mid-market company or a Fortune 500 company.
So let me use that as a segue to go a step back and say,
Okay.
here's what I do, and here's how I came to it. So I used to run a clinic company. I used to own an on-site primary care clinic company, which if you're doing it right is about the management of risk. Healthcare is about 2 kinds of risk: clinical risk and financial risk. And everything that we do in healthcare should be about the management of those functions. Unfortunately, we're in a system that doesn't attend to that at all. And as you said, most everybody in healthcare makes more if it costs more, which is a significant problem that nobody wants to address. So I left. While I was at the clinic company, I was recruited to be the CEO of an organization called the National Business Coalition on Health,
Okay.
which is the association of regional business health coalitions in the country. And what I found when I got in there as the CEO was that all of the regional business coalitions and the national coalition were taking money from pharma and the health plans and the hospitals. So they were effectively undermining their own members' interests.
Sure.
And I tried to get them away from that, and they were not amenable. So I left, and they said goodbye, and everybody was happier. When I left there, it dawned on me that the thing to do was to identify healthcare organizations that get hugely better health outcomes at much lower costs than conventional approaches within these high-value niches. And I have found about 30 of them and vetted them. So I take organizations through a process where once they come to me and they say, look at what I'm doing that's great, then I say, fine, first let's examine what you're doing and see if it's real or not. So that's what I do first. So let me give you an example of that. There is a company in Florida that does musculoskeletal management. Musculoskeletal disorders are 20 to 25% of everything we spend in healthcare, and they're 60% of everything we spend in occupational health. It's a huge piece of the pie. And it's done wrong by and large. Orthopedics does not have a reliable diagnostic methodology, and the numbers show that approximately double the surgeries, or that we should be doing half the surgeries that we're doing in orthopedics, and that half of the ones that we're doing are inappropriate or unnecessary.
Sure.
So what that means is that because somebody has a bad diagnostic methodology, they tend to hold up an image and go, yeah, that looks like it, let's cut. This is a guy who wants to cut anyway, because he's making good money at it. That is a core problem. As terrible as that sounds, that's a core problem in orthopedics, in cardiology, in cancer, where vast amounts of care are given that provide absolutely no benefit to the patient. We know, for example, that stents, coronary artery stents,
Sure.
provide no benefit in stable heart patients. but but thousands of them are delivered every day because they're very lucrative. And what that means is that when a cardiologist inserts a stent in a stable heart patient, that only one of two things can be said about that. One, the guy has not read the literature for 15 years, or second, he knowingly is doing the wrong thing. And that's a core conundrum in healthcare. So I have found organizations that do it better. So this organization in Florida has developed a better mousetrap. I won't go into the details of how the mousetrap works, but they now have clients like Michelin and General Dynamics and the US Army. And the data show after several 100,000 patient encounters that they get not just better results, they get enormously better results. Range of motion, pain reduction, activities of daily living in half the recovery time and half the cost of conventional care. So if you do this, if you go with this organization and do what they have you do, your patients will be better, and you will pay, and your total spend will drop somewhere probably around 8 or 9%. That's an enormous amount of money in healthcare.
Sure. Yeah. So if you look at health systems in general, are there two or three nationally that you would say are just really doing the right thing and really trying to get to a place where they're true partners in the affordability war, as well as you said, there's two kinds of risk. Are they focusing? There's not many that were focusing on the other. So do you evaluate hospitals and health systems as well?
I do not, but let me give you my answer to that.
Okay.
My answer is that there are some that are heading approximately in the right direction.
Sure.
There are none that are doing it well. And the reason is because we've had 55 years of fee-for-service reimbursement, and it just isn't in their interest to make less money. Every hospital guy will say, oh, we're all about value just so long as my per patient reimbursement doesn't go down.
Yeah.
My per patient revenue.
Sure.
So if I were going to name some, Memorial Care in Irvine, they're pretty good. Intermountain out of Salt Lake, they're pretty good. Maybe Baylor, Scott and White, I don't know. Maybe Mayo, maybe Cleveland, maybe Geisinger, I don't know.
Yeah.
But nobody's really doing it well. But these other organizations that I'm talking about, they will see if they succeed, you will see these large organizations be picked apart. It will blow apart their services because they won't be able to leverage having everything done in the hospital at exorbitant rates.
Sure. No, and Memorial Care's right here in my backyard. And I went to college up in Utah, so familiar with Intermountain as well. Know Dr. Feinberg well from Geisinger, and I would agree that those are three organizations that are trying to walk the walk, but the reality is they still have to go to board meetings and explain why the revenues are dipping, because that's a natural evolution of transitioning from putting a head in a bed to keeping somebody healthy and at home. And I mentioned earlier what I wanted to kind of evolve to, and you're starting to see what fabulous experience and how long that Brian's been at this. But what I've been arguing for about 6 months in the end of 2017 and in the beginning of January of 18, we started to see these chips fall, is having been a hospital CEO for 10 years, I saw the power and influence of big EMR, particularly two big EMR companies. There's a third one out there as well, but the top two are actually wagging the dog of the hospitals. So back in 2017, particularly third and fourth quarter, I started getting a lot of questions about, Josh, the tipping point's here, your new book addressing this is coming out. As a former hospital CEO, what's going to really change healthcare affordability in America from a business to business standpoint? And I really went straight to the fact that, hey, look, hospitals have always been the power player. There's no transparency, so the insurers raise the rates, they blame the hospitals, but you know who's really wagging the dog and controlling the hospitals are these two big EMR companies. That when I was a hospital CEO and I called to say, hey, the Obamacare requires us to have an EMR, and they would say, oh yeah, your hospital's too small or you don't make enough money, so go find one of the small fries. We're just going to focus on these big hospitals. And I ended up working for one of those hospitals, and I was blown away by how much control the EMR company had. Usually your vice president of information systems used to work for them. They have the biggest budget. And what I said to a few people is, there will never be good population health and value-based care applications or technology or a commitment to it so long as the people running healthcare have no incentive to keep you healthy and at home. And that's the hospitals and that's the big EMR companies. And every time a good technology comes along, they kick it to the curb because the hospital's not going to pay them to do that. So they're just going to keep swimming in their own waters and building technology that they know they can get the hospital to pay. And there's only 6 companies in the world probably that can change that behavior. And what's been really cool about 2018, even, we recorded this in February, even just in the first 4 or 5 weeks of 2018, you've seen Apple come out and say, hey, we're going to partner with large health systems and put your EMR in your hand on your PDA. Then comes Amazon, Berkshire Hathaway, and JP Morgan partnering to say, hey, we're going to blow up the existing model and start over. And what was cool is they said, we don't even know what we're going to do yet, but we're going to call upon experts like Brian, like Josh, like others to say, help us figure out what this looks like because we can't keep going. Now, even this week, you see Disney in early February come and say, hey, we're going to blow up the system and start over. And look, everybody's quick to say, oh, we've tried this before, it's not going to work. I just feel like these 6 organizations, and I didn't include Disney in there, but Disney's one because they're not technology, is why I didn't include them in my statements. But Disney has the influence and power to get the attention of the big insurers, and they did. As soon as these announcements came out, the stock market had one of its biggest drops in years, single day drops, because within a couple weeks, those healthcare stocks tanked because Apple, Amazon, JP Morgan, Berkshire Hathaway, and Disney all said enough is enough, we've reached our tipping point. So if you were to say, give me 3 concepts that you think that Berkshire Hathaway, Amazon, JP Morgan, and or Disney will implement in their quote-unquote blowing up the system and starting over methodology.
The weakness in the system, let me give you one concept.
Okay.
The biggest weakness in the system is that it costs way too much, and everybody makes more if it costs more, and nobody wants to break that apart. What Amazon and Berkshire Hathaway and JP Morgan can do is they can aggregate solutions that are already out there that are underutilized, that get way better results at much lower cost, and they can get an aggregated savings capability that allows them to walk into an employer and say, if you work with us, we'll financially guarantee you better health outcomes at, pick a number, 25% less than you're currently paying. And when you're paying $14,000 per employee per year, that's a really big number. And it has to be that. So the principle is Amazon, the triumvirate that we're talking about will make employers an offer they can't refuse. And they will go around the Aetnas and the Cignas and the Uniteds of the world, and they will go in droves, and the market structure will change. I firmly believe that's what's going to happen. And I know the companies that are capable of delivering those better results that they should go out and find.
So that's really the whole principle of health wealth. Is healthcare bankrupting your business? 9 steps to financial recovery. Of those 9 steps, I think 6 or 7 of them are existing best practices that can save money. So I want to take it back to a question that I really pivoted my expertise, Brian, between 2017 and 18 to say, I'm going to be the CEO who pulls back the curtain on the hospital industry. I'm going to be the one who says enough is enough. Most families in America can't afford healthcare. Most businesses can no longer afford healthcare. And as I started researching in 2017, I heard the same thing over and over, which got to the point where it upset me, and I said, this is silly. And here's the statement I would like you to expand on. I was told by almost every expert I talked to, like not yourself, but folks similar to you who've been looking at and studying this issue for years, the Fortune 500 companies will tell you they don't care about spending too much on healthcare because they need to retain good talent. Yeah, I just think that's the most inane statement I've ever heard. Because what I know as a CEO of 10 years is I said, hey, you got a PPO or an HMO offering? What's your offering? They said PPO or EPO, and I said, okay, I'm in. I didn't study their policy and which doctors I could go to and which hospitals were included. I don't think many people do. I'm a Gen Xer. I can tell you that millennials, they've already thrown their hands in the air and said, I'll never be able to afford healthcare. So tell me about this false statement that Fortune 500 companies were allegedly hiding behind as an excuse to not hold executives accountable for managing healthcare costs. Is it true? Have you heard this? What are your thoughts?
Well, it depends on what kind of a fortune company you are. I mean, if you're Walmart and your average net earnings per associate or FTE are $8,000, and you're paying $6,000 for healthcare, that's a crazy formula, and it's tough, and they are very sensitive to that, and they do. There are a lot of good aspects and bad aspects to the way they handle their health plans, but they pay attention. But if you're Apple and you're making $1.3 million per associate, then healthcare is a non-issue because you're making so much money. It's just not a big deal. But I think in the rank and file of American business, if you're a school district or if you're a manufacturer, healthcare is a crushing burden. Two statistics that I usually hand off to people. One is in 2011, which is not so long ago, and the data I'm about to tell you still holds today. In 2011, Rand published a study that showed that in the previous decade, the 79% of the growth in household income, which is essentially new dollars in the economy, 79% of all the new dollars in the economy was absorbed by healthcare, meaning only 21% was available for, this stuff doesn't matter, like education and transportation and infrastructure and so on. That is a recipe for the fall of the republic. The second statistic is
that was 2011. A Rand study in 2011.
2011. Yeah, and I'm glad to send it to you.
It'd be great.
The other statistic is that if you are a business operating on the international stage, you have to overcome a difference of more than 9% on your healthcare costs just to be on a level playing field with your competitors in Australia or Germany or Korea. Nobody can do that. 9-10%, that's too high a bar. So healthcare is essentially crushing the viability of the American Republic. And if for no other reason we got to do it, when I stand up in front of healthcare, in front of employer audiences, CFOs, CEOs, people come up to me afterwards and they go, "Are you kidding me? That isn't what they've been saying on Fox and CNN." But I saw a report this morning that estimated that 25% of the cost of healthcare is waste. I can show you where companies have dropped their costs by 60%. And that's probably more the right number. 60-70% of everything we pay provides no value. There was a PricewaterhouseCoopers study in 2008 that showed that 54.5% of everything we spend provides no value. That's probably closer to the number. It's incredible. So it's a much more, as bad as most people think that the healthcare cost crisis is, it's significantly worse than that.
So personalized medicine and preventative medicine. If you were to pick, I always tell people there's 3 P's to becoming an engaged healthcare consumer. Have a plan that's based on personalized medicine, preventative medicine. As an individual, that is the message I deliver to them. The messages for corporations are different. You need to basically create a health wealth culture, change your programs, do a lot of the creative things you've talked about. But for individuals, which would you say is more of a got some sirens going by as we speak. So which would you say is more of should be more of a focus for an individual who wants to reduce their healthcare spend? Preventative medicine tactics or personalized, like DNA testing, naturopathic integrative medicine tactics?
I'm gonna punt on that. I'm gonna say Absolutely. We should all be interested in living healthy lifestyles.
Yeah.
That's a no-brainer. However, here's what I am going to say. The emphasis, and I see this a lot, on mobile technology, on making better decisions, things like that, as the answer to healthcare is a wrong answer.
Sure.
And that is because the reason that we pay double what every other developed country in the world pays is not because we make poor decisions. It is because the system is rigged against us.
Sure.
It is the result of being gamed by the healthcare industry. And so the solutions to that, the huge amounts of unnecessary surgeries and unnecessary treatment, the egregious unit pricing, and so on and so forth. So the reason that I've taken the path I've taken is because the organizations I have found have reversed engineered the games that the healthcare industry has engaged in, and then they act on behalf of the employer.
Agreed very much. Well, hey, I always like to wrap up with a lighter-hearted question, being the big sports fan that I am. So if you had to pick your favorite sports team, whether it was professional or college, which is the team that you root for the most?
This is an embarrassing answer, but I don't. I do long-distance ocean sailing.
Okay, well, there you go.
And so I don't pay any attention at all to the teams.
That's okay, and that's the part of the country you live in. So, I'm an avid boater myself. So, hey, I want to thank Brian Klepper, Dr. Brian Klepper, although he says he never goes by that, but I'm going to give him his proper due. He worked hard to get that PhD. Dr. Brian Klepper, who really is just a wealth of knowledge and history on healthcare affordability, and really stands exactly for what Health Wealth at health-wealth.com, all the things that we stand for, which is just finding individuals like Brian that can help you when you identify your tipping point, help you start that path to savings. And not just, you heard him, not just 10, 20, 30% savings. I purposely, in my book header, I had said 30, 40, 50%. I believe that to be true, but I just narrowed the number down because people outside of this space that Brian and I live in, this war we fight on behalf of America for healthcare affordability, they see numbers like that and they don't believe it. And then they spend 10 minutes with us and they start to believe it. It's true. You can cut your healthcare spend for your organization by 50 to 60% realistically within a year or two if you engage in this process. And Brian, I want to thank you for being on the show. And I want to thank our listeners for tuning in to Health Wealth Nation. You can learn more at health-wealth.com. Tune into the podcast and radio show. You can find it there as well. Brian, thanks for joining us today.
Thanks a lot for having me. I enjoyed it.
All right, likewise.
Pleasure.
Thanks for tuning in to this episode of the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.